NCLEX practice questions with answers. Question 1. A 43-year-old African American male is admitted with sickle cell anemia. The nurse plans to assess circulation in the lower extremities every 2 hours. Which of the following outcome criteria would the nurse use? Here are the options. Option A. Body temperature of 99 degrees F or less. Option B. Toes moved in active range of motion. Option C. Sensation reported when soles of feet are touched. Option D. Capillary refill of 3 seconds. The correct answer is option D. Capillary refill of 3 seconds. Not provided in source. Question 2. A 30-year-old male from Haiti is brought to the emergency department in sickle cell crisis. What is the best position for this client? Here are the options. Option A. Side lying with knees flexed. Option B. Knee chest. Option C. High fowlers with knees flexed. Option D. Semi-fowlers with legs extended on the bed. The correct answer is option D. Semi-fowlers with legs extended on the bed. Not provided in source. Question 3. A 25-year-old male is admitted in sickle cell crisis. Which of the following interventions would be of highest priority for this client? Here are the options. Option A. Taking hourly blood pressures with mechanical cuff. Option B. Encouraging fluid intake of at least 200 ml per hour. Option C. Position in high fowlers with knee gauge raised. Option D. Administering Tylenol as ordered. The correct answer is option B. Encouraging fluid intake of at least 200 ml per hour. Not provided in source. Question 4. Which of the following foods would the nurse encourage the client in sickle cell crisis to eat? Here are the options. Option A. Steak. Option B. Cottage cheese. Option C. Popsicle. Option D. Lima beans. The correct answer is option C. Popsicle. Not provided in source. Question 5. A newly admitted client has sickle cell crisis. He is complaining of pain in his feet and hands. The nurse's assessment findings include a pulse oximetry of 92. Assuming that all the following interventions are ordered, which should be done first? Here are the options. Option A. Adjust the room temperature. Option B. Give a bolus of Roman 4 fluids. Option C. Start O2. Option D. Administer meperidine temerol 75 mg Roman 4 push. The correct answer is option C. Start O2. Not provided in source. Question 6. The nurse is instructing a client with iron deficiency anemia. Which of the following meal plans would the nurse expect the client to select? Here are the options. Option A. Roast beef, gelatin salad, green beans, and peach pie. Option B. Chicken salad sandwich, coleslaw, French fries, ice cream. Option C. Egg salad on wheat bread, carrot sticks, lettuce salad, raisin pie. Option D. Pork chop, creamed potatoes, corn, and coconut cake. The correct answer is option C. Egg salad on wheat bread, carrot sticks, lettuce salad, raisin pie. Not provided in source. Question 7. Clients with sickle cell anemia are taught to avoid activities that cause hypoxia and hyposemia. Which of the following activities would the nurse recommend? Here are the options. Option A. A family vacation in the Rocky Mountains. Option B. Chaperoning the local boys' club on a snow skiing trip. Option C. Traveling by airplane for business trips. Option D. A bus trip to the Museum of Natural History. The correct answer is option D. A bus trip to the Museum of Natural History. Not provided in source. Question 8. The nurse is conducting an admission assessment of a client with vitamin B12 deficiency. Which finding reinforces the diagnosis of B12 deficiency? Here are the options. Option A. Enlarged spleen. Option B. Elevated blood pressure. Option C. Bradycardia. Option D. Beefy tongue. The correct answer is option D. Beefy tongue. Not provided in source. Question 9. The body part that would most likely display jaundice in the dark-skinned individual is the. Here are the options. Option A. Conjunctive of the eye. Option B. Soles of the feet. Option C. Roof of the mouth. Option D. Shins. The correct answer is option C. Roof of the mouth. Not provided in source. Question 10. The nurse is conducting a physical assessment on a client with anemia. Which of the following clinical manifestations would be most indicative of the anemia? Here are the options. Option A. BP 146/88. Option B. Respirations 28 shallow. Option C. Weight gain of 10 pounds in 6 months. Option D. Pink complexion. The correct answer is option B. Respirations 28 shallow. Not provided in source. Question 11. The nurse is teaching the client with polycythemia vera about prevention of complications of the disease. Which of the following statements by the client indicates a need for further teaching? Here are the options. Option A. I will drink 500 ml of fluid or less each day. Option B. I will wear support hose. Option C. I will check my blood pressure regularly. Option D. I will report ankle edema. The correct answer is option A. I will drink 500 ml of fluid or less each day. Not provided in source. Question 12. A 33-year-old male is being evaluated for possible acute leukemia. Which of the following findings is most likely related to the diagnosis of leukemia? Here are the options. Option A. The client collects stamps as a hobby. Option B. The client recently lost his job as a postal worker. Option C. The client had radiation for treatment of Hodgkin's disease as a teenager. Option D. The client's brother had leukemia as a child. The correct answer is option C. The client had radiation for treatment of Hodgkin's disease as a teenager. Not provided in source. Question 13. Where is the best site for examining for the presence of petechiae in an African American client? Here are the options. Option A. The abdomen. Option B. The thorax. Option C. The earlobes. Option D. The soles of the feet. The correct answer is option D. The soles of the feet. Not provided in source. Question 14. The client is being evaluated for possible acute leukemia. Which inquiry by the nurse is most important? Here are the options. Option A. Have you noticed a change in sleeping habits recently? Option B. Have you had a respiratory infection in the last 6 months? Option C. Have you lost weight recently? Option D. Have you noticed changes in your alertness? The correct answer is option B. Have you had a respiratory infection in the last 6 months? Not provided in source. Question 15. Which of the following would be the priority nursing diagnosis for the adult client with acute leukemia? Here are the options. Option A. Oral mucous membrane, altered related to chemotherapy. Option B. Risk for injury related to thrombocytopenia. Option C. Fatigue related to the disease process. Option D. Interrupted family processes related to life-threatening illness of a family member. The correct answer is option B. Risk for injury related to thrombocytopenia. Not provided in source. Question 16. A 21-year-old male with Hodgkin's lymphoma is a senior at the local university. He is engaged to be married and is to begin a new job upon graduation. Which of the following diagnoses would be a priority for this client? Here are the options. Option A. Sexual dysfunction related to radiation therapy. Option B. Anticipatory grieving related to terminal illness. Option C. Tissue integrity related to prolonged bed rest. Option D. Fatigue related to chemotherapy. The correct answer is option A. Sexual dysfunction related to radiation therapy. Not provided in source. Question 17. A client has autoimmune thrombocytopenic purpura. To determine the client's response to treatment, the nurse would monitor. Here are the options. Option A. Platelet count. Option B. White blood cell count. Option C. Potassium levels. Option D. Partial prothrombin time PTT. The correct answer is option A. Platelet count. Not provided in source. Question 18. The home health nurse is visiting a client with autoimmune thrombocytopenic purpura ATP. The client's platelet count currently is 80,000. It will be most important to teach the client and family about. Here are the options. Option A. Bleeding precautions. Option B. Prevention of falls. Option C. Oxygen therapy. Option D. Conservation of energy. The correct answer is option A. Bleeding precautions. Not provided in source. Question 19. The client has surgery for removal of a prolectinoma. Which of the following interventions would be appropriate for this client? Here are the options. Option A. Place the client in Trendelenburg position for postural drainage. Option B. Encourage coughing and deep breathing every 2 hours. Option C. Elevate the head of the bed 30 degrees. Option D. Encourage the Valsalva maneuver for bowel movements. The correct answer is option C. Elevate the head of the bed 30 degrees. Not provided in source. Question 20. The client with a history of diabetes insipidus is admitted with polyuria, polydipsia, and mental confusion. The priority intervention for this client is, here are the options. Option A. Measure the urinary output. Option B. Check the vital signs. Option C. Encourage increased fluid intake. Option D. Weigh the client. The correct answer is option B. Check the vital signs. Not provided in source. Question 21. A client with hemophilia has a nosebleed. Which nursing action is most appropriate to control the bleeding? Here are the options. Option A. Place the client in a sitting position. Option B. Administer acetaminophen Tylenol. Option C. Pinch the soft lower part of the nose. Option D. Apply ice packs to the forehead. The correct answer is option C. Pinch the soft lower part of the nose. Not provided in source. Question 22. A client has had a unilateral adrenalectomy to remove a tumor. The most important measurement in the immediate postoperative period for the nurse to take is, here are the options. Option A. The blood pressure. Option B. The temperature. Option C. The urinary output. Option D. The specific gravity of the urine. The correct answer is option A. The blood pressure. Not provided in source. Question 23. A client with Addison's disease has been admitted with a history of nausea and vomiting for the past 3 days. The client is receiving Roman 4 glucocorticoid Solumetrol. Which of the following interventions would the nurse implement? Here are the options. Option A. Glucometer readings as ordered. Option B. Intake/output measurements. Option C. Evaluating the sodium and potassium levels. Option D. Daily weights. The correct answer is option A. Glucometer readings as ordered. Not provided in source. Question 24. A client had a total thyroidectomy yesterday. The client is complaining of tingling around the mouth and in the fingers and toes. What would the nurse's next action be? Here are the options. Option A. Obtain a crash cart. Option B. Check the calcium level. Option C. Assess the dressing for drainage. Option D. Assess the blood pressure for hypertension. The correct answer is option B. Check the calcium level. Not provided in source. Question 25. A 32-year-old mother of 3 is brought to the clinic. Her pulse is 52. There is a weight gain of 30 pounds in 4 months, and the client is wearing 2 sweaters. The client is diagnosed with hypothyroidism. Which of the following nursing diagnoses is of highest priority? Here are the options. Option A. Impaired physical mobility related to decreased endurance. Option B. Hypothermia r/T decreased metabolic rate. Option C. Disturbed thought processes r/T interstitial edema. Option D. Decreased cardiac output r/T bradycardia. The correct answer is option D. Decreased cardiac output r/T bradycardia. Not provided in source. Question 26. The client presents to the clinic with a serum cholesterol of 275 mg/dl and is placed on rosuvastatin Crestor. Which instruction should be given to the client taking rosuvastatin Crestor? Here are the options. Option A. Report muscle weakness to the physician. Option B. Allow 6 months for the drug to take effect. Option C. Take the medication with fruit juice. Option D. Report difficulty sleeping. The correct answer is option A. Report muscle weakness to the physician. Not provided in source. Question 27. The client is admitted to the hospital with hypertensive crises. Diazoxide hyperstat is ordered. During administration, the nurse should, here are the options. Option A. Utilize an infusion pump. Option B. Check the blood glucose level. Option C. Place the client in Trendelenburg position. Option D. Cover the solution with foil. The correct answer is option B. Check the blood glucose level. Not provided in source. Question 28. The 6-month-old client with a ventroseptal defect is receiving digitalis for regulation of his heart rate. Which finding should be reported to the doctor? Here are the options. Option A. Blood pressure of 126/80. Option B. Blood glucose of 110 mg/dl. Option C. Heart rate of 60 bpm. Option D. Respiratory rate of 30 per minute. The correct answer is option C. Heart rate of 60 bpm. Not provided in source. Question 29. The client admitted with angina is given a prescription for nitroglycerine. The client should be instructed to, here are the options. Option A. Replenish his supply every 3 months. Option B. Take one every 15 minutes if pain occurs. Option C. Leave the medication in the brown bottle. Option D. Crush the medication and take with water. The correct answer is option C. Leave the medication in the brown bottle. Not provided in source. Question 30. The client is instructed regarding foods that are low in fat and cholesterol. Which diet selection is lowest in saturated fats? Here are the options. Option A. Macaroni and cheese. Option B. Shrimp with rice. Option C. Turkey breast. Option D. Spaghetti with meat sauce. The correct answer is option C. Turkey breast. Not provided in source. Question 31. The client is admitted with left-sided congestive heart failure. In assessing the client for edema, the nurse should check the. Here are the options. Option A. Feet. Option B. Neck. Option C. Hands. Option D. Sacrum. The correct answer is option B. Neck. Not provided in source. Question 32. The nurse is checking the client's central venous pressure. The nurse should place the zero of the manometer at the. Here are the options. Option A. Phlebistatic axis. Option B. PMI. Option C. Erb's point. Option D. Tail of Spence. The correct answer is option A. Phlebistatic axis. Not provided in source. Question 33. The physician orders lisinopril, zestrol, and furosemide Lasix to be administered concomitantly to the client with hypertension. The nurse should. Here are the options. Option A. Question the order. Option B. Administer the medications. Option C. Administer separately. Option D. Contact the pharmacy. The correct answer is option B. Administer the medications. Not provided in source. Question 34. The best method of evaluating the amount of peripheral edema is, here are the options. Option A. Weighing the client daily. Option B. Measuring the extremity. Option C. Measuring the intake and output. Option D. Checking for pitting. The correct answer is option B. Measuring the extremity. Not provided in source. Question 35. A client with vaginal cancer is being treated with a radioactive vaginal implant. The client's husband asks the nurse if he can spend the night with his wife. The nurse should explain that. Here are the options. Option A. Overnight stays by family members is against hospital policy. Option B. There is no need for him to stay because staffing is adequate. Option C. His wife will rest much better knowing that he is at home. Option D. Visitation is limited to 30 minutes when the implant is in place. The correct answer is option D. Visitation is limited to 30 minutes when the implant is in place. Not provided in source. Question 36. The nurse is caring for a client hospitalized with a facial stroke. Which diet selection would be suited to the client? Here are the options. Option A. Roast beef sandwich, potato chips, pickle spear, iced tea. Option B. Split pea soup, mashed potatoes, pudding, milk. Option C. Tomato soup, cheese toast, jello, coffee. Option D. Hamburger, baked beans, fruit cup, iced tea. The correct answer is option B. Split pea soup, mashed potatoes, pudding, milk. Not provided in source. Question 37. The physician has prescribed Novolog insulin for a client with diabetes mellitus. Which statement indicates that the client knows when the peak action of the insulin occurs? Here are the options. Option A. I will make sure I eat breakfast within 10 minutes of taking my insulin. Option B. I will need to carry candy or some form of sugar with me all the time. Option C. I will eat a snack around 3 o'clock each afternoon. Option D. I can save my dessert from supper for a bedtime snack. The correct answer is option A. I will make sure I eat breakfast within 10 minutes of taking my insulin. Not provided in source. Question 38. The nurse is teaching basic infant care to a group of first-time parents. The nurse should explain that a sponge bath is recommended for the first 2 weeks of life because. Here are the options. Option A. New parents need time to learn how to hold the baby. Option B. The umbilical cord needs time to separate. Option C. Newborn skin is easily traumatized by washing. Option D. The chance of chilling the baby outweighs the benefits of bathing. The correct answer is option B. The umbilical cord needs time to separate. Not provided in source. Question 39. A client with leukemia is receiving trimethoxate. After reviewing the client's chart, the physician orders Welcavor and Leucavor in calcium. The rationale for administering Leucavor and calcium to a client receiving trimethoxate is to. Here are the options. Option A. Treat iron deficiency anemia caused by chemotherapeutic agents. Option B. Create a synergistic effect that shortens treatment time. Option C. Increase the number of circulating neutrophils. Option D. Reverse drug toxicity and prevent tissue damage. The correct answer is option D. Reverse drug toxicity and prevent tissue damage. Not provided in source. Question 40. A 4-month-old is brought to the Well Baby Clinic for immunization. In addition to the DPT and polio vaccines, the baby should receive. Here are the options. Option A, Hib titer. Option B, mumps vaccine. Option C, hepatitis B vaccine. Option D, MMR. The correct answer is option A, Hib titer. Not provided in source. Question 41. The physician has prescribed Nexium esomeprazole for a client with erosive gastritis. The nurse should administer the medication. Here are the options. Option A, 30 minutes before a meal. Option B, with each meal. Option C, in a single dose at bedtime. Option D, 30 minutes after meals. The correct answer is option A, 30 minutes before a meal. Not provided in source. Question 42. A client on the psychiatric unit is in an uncontrolled rage and is threatening other clients and staff. What is the most appropriate action for the nurse to take? Here are the options. Option A, call security for assistance and prepare to sedate the client. Option B, tell the client to calm down and ask him if he would like to play cards. Option C, tell the client that if he continues his behavior, he will be punished. Option D, leave the client alone until he calms down. The correct answer is option A, call security for assistance and prepare to sedate the client. Not provided in source. Question 43. When the nurse checks the fundus of a client on the first postpartum day, she notes that the fundus is firm, is at the level of the umbilicus, and is displaced to the right. The next action the nurse should take is to. Here are the options. Option A, check the client for bladder distension. Option B, assess the blood pressure for hypotension. Option C, determine whether an oxytocic drug was given. Option D, check for the expulsion of small clots. The correct answer is option A, check the client for bladder distension. Not provided in source. Question 44. A client is admitted to the hospital with a temperature of 99.8 degrees F, complaints of blood-tinged hemoptysis, fatigue, and night sweats. The client's symptoms are consistent with a diagnosis of. Here are the options. Option A, pneumonia. Option B, reaction to antiviral medication. Option C, tuberculosis. Option D, superinfection due to low CD4 count. The correct answer is option C, tuberculosis. Not provided in source. Question 45. The client is seen in the clinic for treatment of migraine headaches. The drug Imitrex sumatriptan 6-8 is prescribed for the client. Which of the following in the client's history should be reported to the doctor? Here are the options. Option A, diabetes. Option B, Prinzmetal's angina. Option C, cancer. Option D, cluster headaches. The correct answer is option B, Prinzmetal's angina. Not provided in source. Question 46. The client with suspected meningitis is admitted to the unit. The doctor is performing an assessment to determine meningeal irritation and spinal nerve root inflammation. A positive Koenig sign is charted if the nurse notes. Here are the options. Option A. Pain on flexion of the hip and knee. Option B. Natural rigidity on flexion of the neck. Option C. Pain when the head is turned to the left side. Option D. Dizziness when changing positions. The correct answer is option A. Pain on flexion of the hip and knee. Not provided in source. Question 47. The client with Alzheimer's disease is being assisted with activities of daily living when the nurse notes that the client uses her toothbrush to brush her hair. The nurse is aware that the client is exhibiting. Here are the options. Option A. Agnosia. Option B. Apraxia. Option C. Anomia. Option D. Aphasia. The correct answer is option B. Apraxia. Not provided in source. Question 48. The client with dementia is experiencing confusion late in the afternoon and before bedtime. The nurse is aware that the client is experiencing what is known as. Here are the options. Option A. Chronic fatigue syndrome. Option B. Normal aging. Option C. Sundowning. Option D. Delusions. The correct answer is option C. Sundowning. Not provided in source. Question 49. The client with confusion says to the nurse, "I haven't had anything to eat all day long. When are they going to bring breakfast?" The nurse saw the client in the day room eating breakfast with other clients 30 minutes before this conversation. Which response would be best for the nurse to make? Here are the options. Option A. You know you had breakfast 30 minutes ago. Option B. I am so sorry that they didn't get you breakfast. I'll report it to the charge nurse. Option C. I'll get you some juice and toast. Would you like something else? Option D. You will have to wait a while. Lunch will be here in a little while. The correct answer is option C. I'll get you some juice and toast. Would you like something else? Not provided in source. Question 50. The doctor has prescribed Exel and rivastigmine for the client with Alzheimer's disease. Which side effect is most often associated with this drug? Here are the options. Option A. Urinary incontinence. Option B. Headaches. Option C. Confusion. Option D. Nausea. The correct answer is option D. Nausea. Not provided in source. Question 51. A client is admitted to the labor and delivery unit in active labor. During examination, the nurse notes a papular lesion on the perineum. Which initial action is most appropriate? Here are the options. Option A. Document the finding. Option B. Report the finding to the doctor. Option C. Prepare the client for a C-section. Option D. Continue primary care as prescribed. The correct answer is option B. Report the finding to the doctor. Not provided in source. Question 52. A client with a diagnosis of HBV is at risk for which of the following? Here are the options. Option A. Hodgkin's lymphoma. Option B. Cervical cancer. Option C. Multiple myeloma. Option D. Ovarian cancer. The correct answer is option B. Cervical cancer. Not provided in source. Question 53. During the initial interview, the client reports that she has a lesion on the perineum. Further investigation reveals a small blister on the vulva that is painful to touch. The nurse is aware that the most likely source of the lesion is, here are the options. Option A, syphilis. Option B, herpes. Option C, gonorrhea. Option D, condylomata. The correct answer is option B, herpes. Not provided in source. Question 54. A client visiting a family planning clinic is suspected of having an STI. The best diagnostic test for trechoma pallidum is, here are the options. Option A, Venereal Disease Research Lab VDRL. Option B, Rapid Plasma Region RPR. Option C, Fluorescent Trepomal Antibody FTA. Option D, Thayer-Martin Culture TMC. The correct answer is option C, Fluorescent Trepomal Antibody FTA. Not provided in source. Question 55. A 15-year-old prima gravida is admitted with a tentative diagnosis of HELLP syndrome. Which laboratory finding is associated with HELLP syndrome? Here are the options. Option A, elevated blood glucose. Option B, elevated platelet count. Option C, elevated creatinine clearance. Option D, elevated hepatic enzymes. The correct answer is option D, elevated hepatic enzymes. Not provided in source. Question 56. The nurse is assessing the deep tendon reflexes of a client with preeclampsia. Which method is used to elicit the biceps reflex? Here are the options. Option A. The nurse places her thumb on the muscle inset in the antecubital space and taps the thumb briskly with the reflex hammer. Option B. The nurse loosely suspends the client's arm in an open hand while tapping the back of the client's elbow. Option C. The nurse instructs the client to dangle her legs as the nurse strikes the area below the patella with the blunt side of the reflex hammer. Option D. The nurse instructs the client to place her arms loosely at her side as the nurse strikes the muscle insert just above the wrist. The correct answer is option A. The nurse places her thumb on the muscle inset in the antecubital space and taps the thumb briskly with the reflex hammer. Not provided in source. Question 57. A prima gravida with diabetes is admitted to the labor and delivery unit at 34 weeks gestation. Which doctor's order should the nurse question? Here are the options. Option A. Magnesium sulfate 4 gm 25% Roman 4. Option B. Brethine 10 mcg Roman 4. Option C. Statol 1 mg Roman 4 push every 4 hours as needed PRN for pain. Option D. Ansif 2 gm IV every 6 hours. The correct answer is option B. Brethine 10 mcg Roman 4. Not provided in source. Question 58. A diabetic multigravida is scheduled for an amniocentesis at 32 weeks gestation to determine the L/S ratio and phosphatidylglycerol level. The L/S ratio is 1:1, and the presence of phosphatidylglycerol is noted. The nurse's assessment of this data is, here are the options. Option A. The infant is at low risk for congenital anomalies. Option B. The infant is at high risk for intrauterine growth retardation. Option C. The infant is at high risk for respiratory distress syndrome. Option D. The infant is at high risk for birth trauma. The correct answer is option C. The infant is at high risk for respiratory distress syndrome. Not provided in source. Question 59. Which observation in the newborn of a diabetic mother would require immediate nursing intervention? Here are the options. Option A. Crying. Option B. Wakefulness. Option C. Jitteriness. Option D. Yawning. The correct answer is option C. Jitteriness. Not provided in source. Question 60. The nurse caring for a client receiving intravenous magnesium sulfate must closely observe for side effects associated with drug therapy. An expected side effect of magnesium sulfate is. Here are the options. Option A. Decreased urinary output. Option B. Hypersomnolence. Option C. Absence of knee-jerk reflex. Option D. Decreased respiratory rate. The correct answer is option B. Hypersomnolence. Not provided in source. Question 61. The client has elected to have epidural anesthesia to relieve labor pain. If the client experiences hypotension, the nurse would. Here are the options. Option A. Place her in Trendelenburg position. Option B. Decrease the rate of Roman IV infusion. Option C. Administer oxygen per nasal cannula. Option D. Increase the rate of the Roman IV infusion. The correct answer is option D. Increase the rate of the Roman IV infusion. Not provided in source. Question 62. A client has cancer of the pancreas. The nurse should be most concerned about which nursing diagnosis. Here are the options. Option A. Alteration in nutrition. Option B. Alteration in bowel elimination. Option C. Alteration in skin integrity. Option D. Ineffective individual coping. The correct answer is option A. Alteration in nutrition. Not provided in source. Question 63. The nurse is caring for a client with uremic frost. The nurse is aware that uremic frost is often seen in clients with. Here are the options. Option A. Severe anemia. Option B. Arteriosclerosis. Option C. Liver failure. Option D. Parathyroid disorder. The correct answer is option C. Liver failure. Not provided in source. Question 64. The client arrives in the emergency department after a motor vehicle accident. Nursing assessment findings include PP 80/34, pulse rate 120, and respirations 20. Which is the client's most appropriate priority nursing diagnosis? Here are the options. Option A. Alteration in cerebral tissue perfusion. Option B. Fluid volume deficit. Option C. Ineffective airway clearance. Option D. Alteration in sensory perception. The correct answer is option B. Fluid volume deficit. Not provided in source. Question 65. The home health nurse is visiting an 18-year-old with osteogenesis imperfecta. Which information obtained on the visit would cause the most concern? The client. Here are the options. Option A. Likes to play football. Option B. Drinks carbonated drinks. Option C. Has two sisters. Option D. Is taking acetaminophen for pain. The correct answer is option A. Likes to play football. Not provided in source. Question 66. The nurse working the organ transplant unit is caring for a client with a white blood cell count of 450. During evening visitation, a visitor brings a basket of fruit. What action should the nurse take? Here are the options. Option A. Allow the client to keep the fruit. Option B. Place the fruit next to the bed for easy access by the client. Option C. Offer to wash the fruit for the client. Option D. Ask the family members to take the fruit home. The correct answer is option D. Ask the family members to take the fruit home. Not provided in source. Question 67. The nurse is caring for the client following a laryngectomy when suddenly the client becomes non-responsive and pale, with a BP of 90/40. The initial nurse's action should be to. Here are the options. Option A. Place the client in Trendelenburg position. Option B. Increase the infusion of normal saline. Option C. Administer atropine intravenously. Option D. Move the emergency cart to the bedside. The correct answer is option B. Increase the infusion of normal saline. Not provided in source. Question 68. The client admitted 2 days earlier with a lung resection accidentally pulls out the chest tube. Which action by the nurse indicates understanding of the management of chest tubes? Here are the options. Option A. Order a chest X-ray. Option B. Reinsert the tube. Option C. Cover the insertion site with a Vaseline gauze. Option D. Call the doctor. The correct answer is option C. Cover the insertion site with a Vaseline gauze. Not provided in source. Question 69. A client being treated with sodium warfarin Coumadin has a prod time of 120 seconds. Which intervention would be most important to include in the nursing care plan? Here are the options. Option A. Assess for signs of abnormal bleeding. Option B. Anticipate an increase in the Coumadin dosage. Option C. Instruct the client regarding the drug therapy. Option D. Increase the frequency of neurological assessments. The correct answer is option A. Assess for signs of abnormal bleeding. Not provided in source. Question 70. Which selection would provide the most calcium for the client who is 4 months pregnant? Here are the options. Option A. A granola bar. Option B. A bran muffin. Option C. A cup of yogurt. Option D. A glass of fruit juice. The correct answer is option C. A cup of yogurt. Not provided in source. Question 71. The client with preeclampsia is admitted to the unit with an order for magnesium sulfate. Which action by the nurse indicates the understanding of magnesium toxicity? Here are the options. Option A. The nurse performs a vaginal exam every 30 minutes. Option B. The nurse places a padded tongue blade at the bedside. Option C. The nurse inserts a Foley catheter. Option D. The nurse darkens the room. The correct answer is option C. The nurse inserts a Foley catheter. Not provided in source. Question 72. The best size cathlon for administration of a blood transfusion to a 6-year-old is. Here are the options. Option A, 18 gauge. Option B, 19 gauge. Option C, 22 gauge. Option D, 20 gauge. The correct answer is option D, 20 gauge. Not provided in source. Question 73. A client is admitted to the unit 2 hours after an explosion causes burns to the face. The nurse would be most concerned with the client developing which of the following? Here are the options. Option A, hypovolemia. Option B, laryngeal edema. Option C, hypernatremia. Option D, hyperkalemia. The correct answer is option B, laryngeal edema. Not provided in source. Question 74. The client has recently been diagnosed with diabetes. Which of the following indicates understanding of the management of diabetes? Here are the options. Option A. The client selects a balanced diet from the menu. Option B. The client can tell the nurse the normal blood glucose level. Option C. The client asks for brochures on the subject of diabetes. Option D. The client demonstrates correct insulin injection technique. The correct answer is option D. The client demonstrates correct insulin injection technique. Not provided in source. Question 75. The client is admitted following cast application for fractured ulna. Which finding should be reported to the doctor? Here are the options. Option A, pain at the site. Option B, warm fingers. Option C, pulses rapid. Option D, paresthesia of the fingers. The correct answer is option D, paresthesia of the fingers. Not provided in source. Question 76. The client with AIDS should be taught to. Here are the options. Option A, avoid warm climates. Option B, refrain from taking herbals. Option C, avoid exercising. Option D, report any changes in skin color. The correct answer is option B, refrain from taking herbals. Not provided in source. Question 77. Which action by the healthcare worker indicates a need for further teaching? Here are the options. Option A. The nursing assistant ambulates the elderly client using a gait belt. Option B. The nurse wears goggles while performing a venipuncture. Option C. The nurse washes his hands after changing a dressing. Option D. The nurse wears gloves to monitor the Roman IV infusion rate. The correct answer is option D. The nurse wears gloves to monitor the Roman IV infusion rate. Not provided in source. Question 78. The client is having electroconvulsive therapy for treatment of severe depression. Prior to the ECT, the nurse should. Here are the options. Option A. Apply a tourniquet to the client's arm. Option B. Administer an anticonvulsant medication. Option C. Ask the client if he is allergic to shellfish. Option D. Apply a blood pressure cuff to the arm. The correct answer is option D. Apply a blood pressure cuff to the arm. Not provided in source. Question 79. The 5-year-old is being tested for enterobiasis pinworms. Which symptom is associated with enterobiasis? Here are the options. Option A. Rectal itching. Option B. Nausea. Option C. Oral ulcerations. Option D. Scalp itching. The correct answer is option A. Rectal itching. Not provided in source. Question 80. The nurse is teaching the mother regarding treatment for pediculosis capitis. Which instruction should be given regarding the medication? Here are the options. Option A. Treatment is not recommended for children less than 10 years of age. Option B. Bed linen should be washed in hot water. Option C. Medication therapy will continue for 1 year. Option D. Intravenous antibiotic therapy will be ordered. The correct answer is option B. Bed linens should be washed in hot water. Not provided in source. Question 81. The registered nurse is making assignments for the day. Which client should be assigned to the pregnant nurse? Here are the options. Option A. The client with HIV. Option B. The client with a radium implant for cervical cancer. Option C. The client with RSV respiratory syncytial virus. Option D. The client with cytomegalovirus. The correct answer is option A. The client with HIV. Not provided in source. Question 82. The nurse is planning room assignments for the day. Which client should be assigned to a private room if only one is available? Here are the options. Option A. The client with methicillin-resistant Staphylococcus aureus MRSA. Option B. The client with diabetes. Option C. The client with pancreatitis. Option D. The client with Addison's disease. The correct answer is option A. The client with methicillin-resistant Staphylococcus aureus MRSA. Not provided in source. Question 83. The doctor accidentally cuts the bowel during surgery. As a result of this action, the client develops an infection and suffers brain damage. The doctor can be charged with, here are the options. Option A. Negligence. Option B. Tort. Option C. Assault. Option D. Malpractice. The correct answer is option D. Malpractice. Not provided in source. Question 84. Which assignment should not be performed by the nursing assistant? Here are the options. Option A. Feeding the client. Option B. Bathing the client. Option C. Obtaining a stool. Option D. Administering a fleet enema. The correct answer is option D. Administering a fleet enema. Not provided in source. Question 85. The mother calls the clinic to report that her newborn has a rash on his forehead and face. Which action is most appropriate? Here are the options. Option A. Tell the mother to wash the face with soap and apply powder. Option B. Tell her that 30% of newborns have a rash that will go away by 1 month of life. Option C. Report the rash to the doctor immediately. Option D. Ask the mother if anyone else in the family has had a rash in the last 6 months. The correct answer is option B. Tell her that 30% of newborns have a rash that will go away by 1 month of life. Not provided in source. Question 86. Which nurse should not be assigned to care for the client with a radium implant for vaginal cancer? Here are the options. Option A. The LPN who is 6 months postpartum. Option B. The RN who is pregnant. Option C. The RN who is allergic to iodine. Option D. The RN with a 3-year-old at home. The correct answer is option B. The RN who is pregnant. Not provided in source. Question 87. Which information should be reported to the State Board of Nursing? Here are the options. Option A. The facility fails to provide literature in both Spanish and English. Option B. The narcotic count has been incorrect on the unit for the past 3 days. Option C. The client fails to receive an itemized account of his bills and services received during his hospital stay. Option D. The nursing assistant assigned to the client with hepatitis fails to feed the client and give the bath. The correct answer is option B. The narcotic count has been incorrect on the unit for the past 3 days. Not provided in source. Question 88. The nurse is suspected of charting medication administration that he did not give. After talking to the nurse, the charge nurse should. Here are the options. Option A. Call the Board of Nursing. Option B. File a formal reprimand. Option C. Terminate the nurse. Option D. Charge the nurse with a tort. The correct answer is option B. File a formal reprimand. Not provided in source. Question 89. The home health nurse is planning for the day's visits. Which client should be seen first? Here are the options. Option A. The 78-year-old who had a gastrectomy 3 weeks ago and has a PED tube. Option B. The 5-month-old discharged 1 week ago with pneumonia who is being treated with amoxicillin liquid suspension. Option C. The 50-year-old with MRSA being treated with vancomycin via a PICC line. Option D. The 30-year-old with an exacerbation of multiple sclerosis being treated with cortisone via a centrally placed venous catheter. The correct answer is option D. The 30-year-old with an exacerbation of multiple sclerosis being treated with cortisone via a centrally placed venous catheter. Not provided in source. Question 90. The emergency room is flooded with clients injured in a tornado. Which clients can be assigned to share a room in the emergency department during the disaster? Here are the options. Option A. A client having auditory hallucinations and the client with ulcerative colitis. Option B. The client who is pregnant and the client with a broken arm. Option C. A child who is cyanotic with severe dyspnea and a client with a frontal head injury. Option D. The client who arrives with a large puncture wound to the abdomen and the client with chest pain. The correct answer is option B. The client who is pregnant and the client with a broken arm. Not provided in source. Question 91. Before administering eardrops to a toddler, the nurse should recognize that it is essential to consider which of the following. Here are the options. Option A. The age of the child. Option B. The child's weight. Option C. The developmental level of the child. Option D. The IQ of the child. The correct answer is option A. The age of the child. Not provided in source. Question 92. The nurse is discussing meal planning with the mother of a 2-year-old. Which of the following statements, if made by the mother, would require a need for further instruction? Here are the options. Option A. It is okay to give my child white grape juice for breakfast. Option B. My child can have a grilled cheese sandwich for lunch. Option C. We are going on a camping trip this weekend, and I have bought hot dogs to grill for his lunch. Option D. For a snack, my child can have ice cream. The correct answer is option C. We are going on a camping trip this weekend, and I have bought hot dogs to grill for his lunch. Not provided in source. Question 93. A client with AIDS has a viral load of 200 copies per ml. The nurse should interpret this finding as, here are the options. Option A. The client is at risk for opportunistic diseases. Option B. The client is no longer communicable. Option C. The client's viral load is extremely low, so he is relatively free of circulating virus. Option D. The client's T-cell count is extremely low. The correct answer is option C. The client's viral load is extremely low, so he is relatively free of circulating virus. Not provided in source. Question 94. The client has an order for sliding scale insulin at 19 hours and Lantus insulin at the same hour. The nurse should, here are the options. Option A. Administer the two medications together. Option B. Administer the medications in 2 injections. Option C. Draw up the Lantus insulin and then the regular insulin and administer them together. Option D. Contact the doctor because these medications should not be given to the same client. The correct answer is option B. Administer the medications in 2 injections. Not provided in source. Question 95. A priority nursing diagnosis for a child being admitted from surgery following a tonsillectomy is, here are the options. Option A. Altered nutrition. Option B. Impaired communication. Option C. Risk for injury/aspiration. Option D. Altered urinary elimination. The correct answer is option C. Risk for injury/aspiration. Not provided in source. Question 96. What would the nurse expect the admitting assessment to reveal in a client with glomerulonephritis? Here are the options. Option A. Hypertension. Option B. Lassitude. Option C. Fatigue. Option D. Vomiting and diarrhea. The correct answer is option A. Hypertension. Not provided in source. Question 97. Which action is contraindicated in the client with epiglottitis? Here are the options. Option A. Ambulation. Option B. Oral airway assessment using a tongue blade. Option C. Placing a blood pressure cuff on the arm. Option D. Checking the deep tendon reflexes. The correct answer is option B. Oral airway assessment using a tongue blade. Not provided in source. Question 98. A 25-year-old client with a goiter is admitted to the unit. What would the nurse expect the admitting assessment to reveal? Here are the options. Option A. slow pulse. Option B, anorexia. Option C, bulging eyes. Option D, weight gain. The correct answer is option C, bulging eyes. Not provided in source. Question 99. Which of the following foods, if selected by the mother with a child with celiac, would indicate her understanding of the dietary instructions? Here are the options. Option A, whole wheat toast. Option B, angel hair pasta. Option C, Reuben on rye. Option D, rice cereal. The correct answer is option D, rice cereal. Not provided in source. Question 100. The first action that the nurse should take if she finds the client has an O2 saturation of 68% is, here are the options. Option A, elevate the head. Option B, recheck the O2 saturation in 30 minutes. Option C, apply oxygen by mask. Option D, assess the heart rate. The correct answer is option C, apply oxygen by mask. Not provided in source. Question 101. Which observation would the nurse expect to make after an amniotomy? Here are the options. Option A, dark yellow amniotic fluid. Option B, clear amniotic fluid. Option C, greenish amniotic fluid. Option D, red amniotic fluid. The correct answer is option B, clear amniotic fluid. Not provided in source. Question 102. The client taking glyburide diabetes should be cautioned to. Here are the options. Option A, avoid eating sweets. Option B, report changes in urinary pattern. Option C, allow 3 hours for onset. Option D, check the glucose daily. The correct answer is option D, check the glucose daily. Not provided in source. Question 103. The obstetric client's fetal heart rate is 80-90 during the contractions. The first action the nurse should take is, here are the options. Option A, reposition the monitor. Option B, turn the client to her left side. Option C, ask the client to ambulate. Option D, prepare the client for delivery. The correct answer is option B, turn the client to her left side. Not provided in source. Question 104. Arterial ulcers are best described as ulcers that, here are the options. Option A, are smooth in texture. Option B, have irregular borders. Option C, are cool to touch. Option D, are painful to touch. The correct answer is option D, are painful to touch. Not provided in source. Question 105. A vaginal exam reveals a footling breech presentation. The nurse should take which of the following actions at this time? Here are the options. Option A, anticipate the need for a cesarean section. Option B, apply an internal fetal monitor. Option C, place the client in genupectoral position. Option D, perform an ultrasound. The correct answer is option B, apply an internal fetal monitor. Not provided in source. Question 106. A vaginal exam reveals that the cervix is forcibly dilated, with intact membranes and a fetal heart tone rate of 160-170 bpm. The nurse decides to apply an external fetal monitor. The rationale for this implementation is, here are the options. Option A. The cervix is closed. Option B. The membranes are still intact. Option C. The fetal heart tones are within normal limits. Option D. The contractions are intense enough for insertion of an internal monitor. The correct answer is option B. The membranes are still intact. Not provided in source. Question 107. The following are all nursing diagnoses appropriate for gravida 1 para 0 in labor. Which one would be most appropriate for the prima gravida as she completes the early phase of labor? Here are the options. Option A. Impaired gas exchange related to hyperventilation. Option B. Alteration in placental perfusion related to maternal position. Option C. Impaired physical mobility related to fetal monitoring equipment. Option D. Potential fluid volume deficit related to decreased fluid intake. The correct answer is option D. Potential fluid volume deficit related to decreased fluid intake. Not provided in source. Question 108. As the client reaches 6 cm dilation, the nurse notes late decelerations on the fetal monitor. What is the most likely explanation of this pattern? Here are the options. Option A. The baby is sleeping. Option B. The umbilical cord is compressed. Option C. There is head compression. Option D. There is uteroplacental insufficiency. The correct answer is option D. There is uteroplacental insufficiency. Not provided in source. Question 109. The nurse notes variable decelerations on the fetal monitor strip. The most appropriate initial action would be to, here are the options. Option A. Notify her doctor. Option B. Start enrollment for. Option C. Reposition the client. Option D. Readjust the monitor. The correct answer is option C. Reposition the client. Not provided in source. Question 110. Which of the following is a characteristic of an ominous periodic change in the fetal heart rate? Here are the options. Option A. A fetal heart rate of 120-130 bpm. Option B. A baseline variability of 6-10 bpm. Option C. Accelerations in FHR with fetal movement. Option D. A recurrent rate of 90-100 bpm at the end of the contractions. The correct answer is option D. A recurrent rate of 90-100 bpm at the end of the contractions. Not provided in source. Question 111. The rationale for inserting a French catheter every hour for the client with epidural anesthesia is, here are the options. Option A. The bladder fills more rapidly because of the medication used for the epidural. Option B. Her level of consciousness is such that she is in a trance-like state. Option C. The sensation of the bladder filling is diminished or lost. Option D. She is embarrassed to ask for the bedpan that frequently. The correct answer is option C. The sensation of the bladder filling is diminished or lost. Not provided in source. Question 112. A client in the family planning clinic asks the nurse about the most likely time for her to conceive. The nurse explains that conception is most likely to occur when. Here are the options. Option A. Estrogen levels are low. Option B. Luteinizing hormone is high. Option C. The endometrial lining is thin. Option D. The progesterone level is low. The correct answer is option B. Luteinizing hormone is high. Not provided in source. Question 113. A client tells the nurse that she plans to use the rhythm method of birth control. The nurse is aware that the success of the rhythm method depends on the. Here are the options. Option A. Age of the client. Option B. Frequency of intercourse. Option C. Regularity of the menses. Option D. Range of the client's temperature. The correct answer is option C. Regularity of the menses. Not provided in source. Question 114. A client with diabetes asks the nurse for advice regarding methods of birth control. Which method of birth control is most suitable for the client with diabetes? Here are the options. Option A. Intrauterine device. Option B. Oral contraceptives. Option C. Diaphragm. Option D. Contraceptive sponge. The correct answer is option C. Diaphragm. Not provided in source. Question 115. The doctor suspects that the client has an ectopic pregnancy. Which symptom is consistent with the diagnosis of a ruptured ectopic pregnancy? Here are the options. Option A. Painless vaginal bleeding. Option B. Abdominal cramping. Option C. Throbbing pain in the upper quadrant. Option D. Sudden, stabbing pain in the lower quadrant. The correct answer is option D. Sudden, stabbing pain in the lower quadrant. Not provided in source. Question 116. The nurse is teaching a pregnant client about nutritional needs during pregnancy. Which menu selection will best meet the nutritional needs of the pregnant client? Here are the options. Option A. Hamburger patty, green beans, French fries, and iced tea. Option B. Roast beef sandwich, potato chips, baked beans, and cola. Option C. Baked chicken, fruit cup, potato salad, coleslaw, yogurt, and iced tea. Option D. Fish sandwich, gelatin with fruit, and coffee. The correct answer is option C. Baked chicken, fruit cup, potato salad, coleslaw, yogurt, and iced tea. Not provided in source. Question 117. The client with hyperemesis gravidarum is at risk for developing. Here are the options. Option A. Respiratory alkalosis without dehydration. Option B. Metabolic acidosis with dehydration. Option C. Respiratory acidosis without dehydration. Option D. Metabolic alkalosis with dehydration. The correct answer is option B. Metabolic acidosis with dehydration. Not provided in source. Question 118. A client tells the doctor that she is about 20 weeks pregnant. The most definitive sign of pregnancy is. Here are the options. Option A. Elevated human chorionic gonadotropin. Option B. The presence of fetal heart tones. Option C. uterine enlargement. Option D, breast enlargement and tenderness. The correct answer is option B, the presence of fetal heart tones. Not provided in source. Question 119. The nurse is caring for a neonate whose mother is diabetic. The nurse will expect the neonate to be. Here are the options. Option A, hypoglycemic, small for gestational age. Option B, hyperglycemic, large for gestational age. Option C, hypoglycemic, large for gestational age. Option D, hyperglycemic, small for gestational age. The correct answer is option C, hypoglycemic, large for gestational age. Not provided in source. Question 120. Which of the following instructions should be included in the nurse's teaching regarding oral contraceptives? Here are the options. Option A, weight gain should be reported to the physician. Option B, an alternate method of birth control is needed when taking antibiotics. Option C, if the client misses one or more pills, 2 pills should be taken per day for 1 week. Option D, changes in the menstrual flow should be reported to the physician. The correct answer is option B. An alternate method of birth control is needed when taking antibiotics. Not provided in source. Question 121. The nurse is discussing breastfeeding with a postpartum client. Breastfeeding is contraindicated in the postpartum client with, here are the options. Option A, diabetes. Option B, HIV. Option C, hypertension. Option D, thyroid disease. The correct answer is option B, HIV. Not provided in source. Question 122. A client is admitted to the labor and delivery unit complaining of vaginal bleeding with very little discomfort. The nurse's first action should be to. Here are the options. Option A, assess the fetal heart tones. Option B, check for cervical dilation. Option C, check for firmness of the uterus. Option D, obtain a detailed history. The correct answer is option A, assess the fetal heart tones. Not provided in source. Question 123. A client telephones the emergency room stating that she thinks that she is in labor. The nurse should tell the client that labor has probably begun when. Here are the options. Option A, her contractions are 2 minutes apart. Option B, she has back pain and a bloody discharge. Option C, she experiences abdominal pain and frequent urination. Option D, her contractions are 5 minutes apart. The correct answer is option D. Her contractions are 5 minutes apart. Not provided in source. Question 124. The nurse is teaching a group of prenatal clients about the effects of cigarette smoke on fetal development. Which characteristic is associated with babies born to mothers who smoked during pregnancy? Here are the options. Option A, low birth weight. Option B, large for gestational age. Option C, preterm birth, but appropriate size for gestation. Option D, growth retardation in weight and length. The correct answer is option A, low birth weight. Not provided in source. Question 125. The physician has ordered an injection of RhoGAM for the postpartum client whose blood type is A negative but whose baby is O positive. To provide postpartum prophylaxis, RhoGAM should be administered. Here are the options. Option A. Within 72 hours of delivery. Option B. Within 1 week of delivery. Option C. Within 2 weeks of delivery. Option D. Within 1 month of delivery. The correct answer is option A. Within 72 hours of delivery. Not provided in source. Question 126. After the physician performs an amniotomy, the nurse's first action should be to assess the. Here are the options. Option A. Degree of cervical dilation. Option B. Fetal heart tones. Option C. Client's vital signs. Option D. Client's level of discomfort. The correct answer is option B. Fetal heart tones. Not provided in source. Question 127. A client is admitted to the labor and delivery unit. The nurse performs a vaginal exam and determines that the client's cervix is 5 cm dilated with 75% effacement. Based on the nurse's assessment, the client is in which phase of labor? Here are the options. Option A. Active. Option B. Latent. Option C. Transition. Option D. Early. The correct answer is option A. Active. Not provided in source. Question 128. A newborn with narcotic abstinence syndrome is admitted to the nursery. Nursing care of the newborn should include. Here are the options. Option A. Teaching the mother to provide tactile stimulation. Option B. Wrapping the newborn snugly in a blanket. Option C. Placing the newborn in the infant seat. Option D. Initiating an early infant stimulation program. The correct answer is option B. Wrapping the newborn snugly in a blanket. Not provided in source. Question 129. A client elects to have epidural anesthesia to relieve the discomfort of labor. Following the initiation of epidural anesthesia, the nurse should give priority to. Here are the options. Option A. Checking for cervical dilation. Option B. Placing the client in a supine position. Option C. Checking the client's blood pressure. Option D. Obtaining a fetal heart rate. The correct answer is option C. Checking the client's blood pressure. Not provided in source. Question 130. The nurse is aware that the best way to prevent postoperative wound infection in the surgical client is to. Here are the options. Option A. Administer a prescribed antibiotic. Option B. Wash your hands for 2 minutes before care. Option C. Wear a mask when providing care. Option D. Ask the client to cover her mouth when she coughs. The correct answer is option B. Wash your hands for 2 minutes before care. Not provided in source. Question 131. The elderly client is admitted to the emergency room. Which symptom is the client with a fractured hip most likely to exhibit? Here are the options. Option A. Pain. Option B. Disalignment. Option C. Cool extremity. Option D. Absence of pedal pulses. The correct answer is option B. Disalignment. Not provided in source. Question 132. The nurse knows that a 60-year-old female client's susceptibility to osteoporosis is most likely related to. Here are the options. Option A. Lack of exercise. Option B. Hormonal disturbances. Option C. Lack of calcium. Option D. Genetic predisposition. The correct answer is option B. Hormonal disturbances. Not provided in source. Question 133. A 2-year-old is admitted for repair of a fractured femur and is placed in Bryant's traction. Which finding by the nurse indicates that the traction is working properly? Here are the options. Option A. The infant no longer complains of pain. Option B. The buttocks are 15 degrees off the bed. Option C. The legs are suspended in the traction. Option D. The pins are secured within the pulley. The correct answer is option B. The buttocks are 15 degrees off the bed. Not provided in source. Question 134. Which statement is true regarding balanced skeletal traction? Balanced skeletal traction. Here are the options. Option A. Uses a stymon pin. Option B. Requires that both legs be secured. Option C. Utilizes Kirschner wires. Option D. Is used primarily to heal the fractured hips. The correct answer is option A. Uses a stymon pin. Not provided in source. Question 135. The client is admitted for an open reduction internal fixation of a fractured hip. Immediately following surgery, the nurse should give priority to assessing the. Here are the options. Option A. Serum collection Davol drain. Option B. Client's pain. Option C. Nutritional status. Option D. Immobilizer. The correct answer is option A. Serum collection Davol drain. Not provided in source. Question 136. Which statement made by the family member caring for the client with a percutaneous gastrostomy tube indicates understanding of the nurse's teaching? Here are the options. Option A. I must flush the tube with water after feedings and clamp the tube. Option B. I must check placement 4 times per day. Option C. I will report to the doctor any signs of indigestion. Option D. If my father is unable to swallow, I will discontinue the feeding and call the clinic. The correct answer is option A. I must flush the tube with water after feedings and clamp the tube. Not provided in source. Question 137. The nurse is assessing the client with a total knee replacement 2 hours postoperative. Which information requires notification of the doctor? Here are the options. Option A. Scant bleeding on the dressing. Option B. Low-grade temperature. Option C. Hemoglobin of 7 gm. Option D. The urinary output has been 120 ml during the last hour. The correct answer is option C. Hemoglobin of 7 gm. Not provided in source. Question 138. The nurse is caring for the client with a 5-year-old diagnosis of plumbism. Which information in the health history is most likely related to the development of plumbism? Here are the options. Option A. The client has traveled out of the country in the last 6 months. Option B. The client's parents are skilled stained glass artists. Option C. The client lives in a house built in 1990. Option D. The client has several brothers and sisters. The correct answer is option B. The client's parents are skilled stained glass artists. Not provided in source. Question 139. A client with a total hip replacement requires special equipment. Which equipment would assist the client with a total hip replacement with activities of daily living? Here are the options. Option A. High-seat commode. Option B. Recliner. Option C. TENS unit. Option D. Abduction pillow. The correct answer is option A. High-seat commode. Not provided in source. Question 140. An elderly client with an abdominal surgery is admitted to the unit following surgery. In anticipation of complications of anesthesia and narcotic administration, the nurse should. Here are the options. Option A. Administer oxygen via nasal cannula. Option B. Have Narcan naloxone available. Option C. Prepare to administer blood products. Option D. Prepare to do cardioresuscitation. The correct answer is option B. Have Narcan naloxone available. Not provided in source. Question 141. Which rheumite would be most suitable for the 6-year-old male with a fractured femur in Russell's traction? Here are the options. Option A. 16-year-old female with scoliosis. Option B. 12-year-old male with a fractured femur. Option C. 10-year-old male with sarcoma. Option D. 6-year-old male with osteomyelitis. The correct answer is option B. 12-year-old male with a fractured femur. Not provided in source. Question 142. A client with osteoarthritis has a prescription for Celebrex celecoxib. Which instruction should be included in the discharge teaching? Here are the options. Option A. Take the medication with milk. Option B. Report chest pain. Option C. Remain upright after taking for 30 minutes. Option D. Allow 6 weeks for optimal effects. The correct answer is option B. Report chest pain. Not provided in source. Question 143. A client with a fractured tibia has a plaster of Paris cast applied to immobilize the fracture. Which action by the nurse indicates understanding of a plaster of Paris cast? The nurse. Here are the options. Option A. Handles the cast with the fingertips. Option B. Pedals the cast. Option C. Dries the cast with a hair dryer. Option D. Allows 24 hours before bearing weight. The correct answer is option D. Allows 24 hours before bearing weight. Not provided in source. Question 144. The teenager with a fiberglass cast asks the nurse if it will be okay to allow his friends to autograph his cast. Which response would be best? Here are the options. Option A. It will be all right for your friends to autograph the cast. Option B. Because the cast is made of plaster, autographing can weaken the cast. Option C. If they don't use chalk to autograph, it is okay. Option D. Autographing or writing on the cast in any form will harm the cast. The correct answer is option A. It will be all right for your friends to autograph the cast. Not provided in source. Question 145. The nurse is assigned to care for the client with a Steinman pin. During pain care, she notes that the LPN uses sterile gloves and Q-tips to clean a pin. Which action should the nurse take at this time? Here are the options. Option A. Assisting the LPN with opening sterile packages and peroxide. Option B. Telling the LPN that clean gloves are allowed. Option C. Telling the LPN that the registered nurse should perform pin care. Option D. Asking the LPN to clean the weights and pulleys with peroxide. The correct answer is option A. Assisting the LPN with opening sterile packages and peroxide. Not provided in source. Question 146. A child with scoliosis has a spica cast applied. Which action specific to the spica cast should be taken? Here are the options. Option A. Check the bowel sounds. Option B. Assess the blood pressure. Option C. Offer pain medication. Option D. Check for swelling. The correct answer is option A. Check the bowel sounds. Not provided in source. Question 147. The client with a cervical fracture is placed in traction. Which type of traction will be utilized at the time of discharge? Here are the options. Option A. Russell's traction. Option B. Buck's traction. Option C. Halo traction. Option D. Crutchfield tongue traction. The correct answer is option C. Halo traction. Not provided in source. Question 148. A client with a total knee replacement has a CPM continuous passive motion device applied during the postoperative period. Which statement made by the nurse indicates understanding of the CPM machine? Here are the options. Option A. Use of the CPM will permit the client to ambulate during the therapy. Option B. The CPM machine control should be positioned distal to the site. Option C. If the client complains of pain during the therapy, I will turn off the machine and call the doctor. Option D. Use of the CPM machine will alleviate the need for physical therapy after the client is discharged. The correct answer is option B. The CPM machine control should be positioned distal to the site. Not provided in source. Question 149. A client with a fractured hip is being taught correct use of the walker. The nurse is aware that the correct use of the walker is achieved if the... Here are the options. Option A. Palms rest lightly on the handles. Option B. Elbows are flexed 0 degrees. Option C. Client walks to the front of the walker. Option D. Client carries the walker. The correct answer is option A. Palms rest lightly on the handles. Not provided in source. Question 150. When assessing a laboring client, the nurse finds a prolapsed cord. The nurse should... Here are the options. Option A. Attempt to replace the cord. Option B. Place the client on her left side. Option C. Elevate the client's hips. Option D. Cover the cord with a dry, sterile gauze. The correct answer is option C. Elevate the client's hips. Not provided in source. Question 151. The nurse is caring for a 30-year-old male admitted with a stab wound. While in the emergency room, a chest tube is inserted. Which of the following explains the primary rationale for insertion of chest tubes? Here are the options. Option A. The tube will allow for equalization of the lung expansion. Option B. Chest tubes serve as a method of draining blood and serous fluid and assist in reinflating the lungs. Option C. Chest tubes relieve pain associated with a collapsed lung. Option D. Chest tubes assist with cardiac function by stabilizing lung expansion. The correct answer is option B. Chest tubes serve as a method of draining blood and serous fluid and assist in reinflating the lungs. Not provided in source. Question 152. A client who delivered this morning tells the nurse that she plans to breastfeed her baby. The nurse is aware that successful breastfeeding is most dependent on the. Here are the options. Option A. Mother's educational level. Option B. Infant's birth weight. Option C. Size of the mother's breast. Option D. Mother's desire to breastfeed. The correct answer is option D. Mother's desire to breastfeed. Not provided in source. Question 153. The nurse is monitoring the progress of a client in labor. Which finding should be reported to the physician immediately? Here are the options. Option A. The presence of scant bloody discharge. Option B. Frequent urination. Option C. The presence of green-tinged amniotic fluid. Option D. Moderate uterine contractions. The correct answer is option C. The presence of green-tinged amniotic fluid. Not provided in source. Question 154. The nurse is measuring the duration of the client's contractions. Which statement is true regarding the measurement of the duration of contractions? Here are the options. Option A. Duration is measured by timing from the beginning of one contraction to the beginning of the next contraction. Option B. Duration is measured by timing from the end of one contraction to the beginning of the next contraction. Option C. Duration is measured by timing from the beginning of one contraction to the end of the same contraction. Option D. Duration is measured by timing from the peak of one contraction to the end of the same contraction. The correct answer is option C. Duration is measured by timing from the beginning of one contraction to the end of the same contraction. Not provided in source. Question 155. The physician has ordered an intravenous infusion of pitocin for the induction of labor. When caring for the obstetric client receiving intravenous pitocin, the nurse should monitor for. Here are the options. Option A. Maternal hypoglycemia. Option B. Fetal bradycardia. Option C. Maternal hyperreflexia. Option D. Fetal movement. The correct answer is option B. Fetal bradycardia. Not provided in source. Question 156. A client with diabetes visits the prenatal clinic at 28 weeks gestation. Which statement is true regarding insulin needs during pregnancy? Here are the options. Option A. Insulin requirements moderate as the pregnancy progresses. Option B. A decreased need for insulin occurs during the second trimester. Option C. Elevations in human chorionic gonadotrophin decrease the need for insulin. Option D. Fetal development depends on adequate insulin regulation. The correct answer is option D. Fetal development depends on adequate insulin regulation. Not provided in source. Question 157. A client in the prenatal clinic is assessed to have a blood pressure of 180/96. The nurse should give priority to. Here are the options. Option A. Providing a calm environment. Option B. Obtaining a diet history. Option C. Administering an analgesic. Option D. Assessing fetal heart tones. The correct answer is option A. Providing a calm environment. Not provided in source. Question 158. A prima gravida, age 42, is 6 weeks pregnant. Based on the client's age, her infant is at risk for. Here are the options. Option A. Down syndrome. Option B. Respiratory distress syndrome. Option C. Turner syndrome. Option D. Pathological jaundice. The correct answer is option A. Down syndrome. Not provided in source. Question 159. A client with a missed abortion at 29 weeks gestation is admitted to the hospital. The client will most likely be treated with. Here are the options. Option A. Magnesium sulfate. Option B. Calcium gluconate. Option C. Diniprostone prostin E. Option D. Bromocriptine parlodal. The correct answer is option C. Diniprostone prostin E. Not provided in source. Question 160. A client with preeclampsia has been receiving an infusion containing magnesium sulfate for a blood pressure that is 160/80. Deep tendon reflexes are 1+, and the urinary output for the past hour is 100 ml. The nurse should. Here are the options. Option A. Continue the infusion of magnesium sulfate while monitoring the client's blood pressure. Option B. Stop the infusion of magnesium sulfate and contact the physician. Option C. Slow the infusion rate and turn the client on her left side. Option D. Administer calcium gluconate Roman 4 push and continue to monitor the blood pressure. The correct answer is option A. Continue the infusion of magnesium sulfate while monitoring the client's blood pressure. Not provided in source. Question 161. Which statement made by the nurse describes the inheritance pattern of autosomal recessive disorders? Here are the options. Option A. An affected newborn has unaffected parents. Option B. An affected newborn has one affected parent. Option C. Affected parents have a 1 in 4 chance of passing on the defective gene. Option D. Affected parents have unaffected children who are carriers. The correct answer is option C. Affected parents have a 1 in 4 chance of passing on the defective gene. Not provided in source. Question 162. A pregnant client, age 32, asks the nurse why her doctor has recommended a serum alpha-fetoprotein. The nurse should explain that the doctor has recommended the test. Here are the options. Option A. Because it is a state law. Option B. To detect cardiovascular defects. Option C. Because of her age. Option D. To detect neurological defects. The correct answer is option D. To detect neurological defects. Not provided in source. Question 163. A client with hypothyroidism asks the nurse if she will still need to take thyroid medication during the pregnancy. The nurse's response is based on the knowledge that, here are the options. Option A. There is no need to take thyroid medication because the fetus's thyroid produces a thyroid-stimulating hormone. Option B. Regulation of thyroid medication is more difficult because the thyroid gland increases in size during pregnancy. Option C. It is more difficult to maintain thyroid regulation during pregnancy due to a slowing of metabolism. Option D. Fetal growth is arrested if thyroid medication is continued during pregnancy. The correct answer is option B. Regulation of thyroid medication is more difficult because the thyroid gland increases in size during pregnancy. Not provided in source. Question 164. The nurse is responsible for performing a neonatal assessment on a full-term infant. At 1 minute, the nurse could expect to find, here are the options. Option A. An apical pulse of 100. Option B. An absence of tonus. Option C. Cyanosis of the feet and hands. Option D. Jaundice of the skin and sclea. The correct answer is option C. Cyanosis of the feet and hands. Not provided in source. Question 165. A client with sickle cell anemia is admitted to the labor and delivery unit during the first phase of labor. The nurse should anticipate the client's need for, here are the options. Option A. Supplemental oxygen. Option B. Fluid restriction. Option C. Blood transfusion. Option D. Delivery by cesarean section. The correct answer is option A. Supplemental oxygen. Not provided in source. Question 166. A client with diabetes has an order for ultrasonography. Preparation for an ultrasound includes, here are the options. Option A. Increasing fluid intake. Option B. Limiting ambulation. Option C. Administering an enema. Option D. Withholding food for 8 hours. The correct answer is option A. Increasing fluid intake. Not provided in source. Question 167. An infant who weighs 8 pounds at birth would be expected to weigh how many pounds at 1 year? Here are the options. Option A. 14 pounds. Option B. 16 pounds. Option C. 18 pounds. Option D. 24 pounds. The correct answer is option D. 24 pounds. Not provided in source. Question 168. A pregnant client with a history of alcohol addiction is scheduled for a non-stress test. The non-stress test, here are the options. Option A. Determines the lung maturity of the fetus. Option B. Measures the activity of the fetus. Option C. Shows the effect of contractions on the fetal heart rate. Option D. Measures the neurological well-being of the fetus. The correct answer is option B. Measures the activity of the fetus. Not provided in source. Question 169. A full-term male has hypospadias. Which statement describes hypospadias? Here are the options. Option A. The urethral opening is absent. Option B. The urethra opens on the top side of the penis. Option C. The urethral opening is enlarged. Option D. The urethra opens on the underside of the penis. The correct answer is option D. The urethra opens on the underside of the penis. Not provided in source. Question 170. A gravida Roman 3 para Roman 2 is admitted to the labor unit. Vaginal exam reveals that the client's cervix is 8 cm dilated, with complete effacement. The priority nursing diagnosis at this time is, here are the options. Option A. Alteration in coping related to pain. Option B. Potential for injury related to precipitate delivery. Option C. Alteration in elimination related to anesthesia. Option D. Potential for fluid volume deficit related to NPO status. The correct answer is option A. Alteration in coping related to pain. Not provided in source. Question 171. The client with varicella will most likely have an order for which category of medication? Here are the options. Option A. Antibiotics. Option B. Antipyretics. Option C. Antivirals. Option D. Anticoagulants. The correct answer is option C. Antivirals. Not provided in source. Question 172. A client is admitted complaining of chest pain. Which of the following drug orders should the nurse question? Here are the options. Option A. Nitroglycerin. Option B. Ampicillin. Option C. Propranolol. Option D. Verapamil. The correct answer is option B. Ampicillin. Not provided in source. Question 173. Which of the following instructions should be included in the teaching for the client with rheumatoid arthritis? Here are the options. Option A. Avoid exercise because it fatigues the joints. Option B. Take prescribed anti-inflammatory medications with meals. Option C. Alternate hot and cold packs to affected joints. Option D. Avoid weight-bearing activity. The correct answer is option B. Take prescribed anti-inflammatory medications with meals. Not provided in source. Question 174. A client with acute pancreatitis is experiencing severe abdominal pain. Which of the following orders should be questioned by the nurse? Here are the options. Option A. Meperidine 100 mg IM 4 hours PRN pain. Option B. Mylanta 30 cc 4 hours via NG. Option C. Cyntidine 300 mg POMID. Option D. Morphine 8 mg IM 4 hours PRN pain. The correct answer is option D. Morphine 8 mg IM 4 hours PRN pain. Not provided in source. Question 175. The client is admitted to the chemical dependence unit with an order for continuous observation. The nurse is aware that the doctor has ordered continuous observation because, here are the options. Option A. Hallucinogenic drugs create both stimulant and depressant effects. Option B. Hallucinogenic drugs induce a state of altered perception. Option C. Hallucinogenic drugs produce severe respiratory depression. Option D. Hallucinogenic drugs induce rapid physical dependence. The correct answer is option B. Hallucinogenic drugs induce a state of altered perception. Not provided in source. Question 176. A client with a history of abusing barbiturates abruptly stops taking the medication. The nurse should give priority to assessing the client for. Here are the options. Option A. Depression and suicidal ideation. Option B. Tachycardia and diarrhea. Option C. Muscle cramping and abdominal pain. Option D. Tachycardia and euphoric mood. The correct answer is option B. Tachycardia and diarrhea. Not provided in source. Question 177. During the assessment of a laboring client, the nurse notes that the FHD are loudest in the upper right quadrant. The infant is most likely in which position? Here are the options. Option A. Right breech presentation. Option B. Right occipital anterior presentation. Option C. Left sacral anterior presentation. Option D. Left occipital transverse presentation. The correct answer is option A. Right breech presentation. Not provided in source. Question 178. The primary physiological alteration in the development of asthma is. Here are the options. Option A. Bronchiolar inflammation and dyspnea. Option B. Hypersecretion of abnormally viscous mucus. Option C. Infectious processes causing mucosal edema. Option D. Spasm of bronchiolar smooth muscle. The correct answer is option D. Spasm of bronchiolar smooth muscle. Not provided in source. Question 179. A client with mania is unable to finish her dinner. To help her maintain sufficient nourishment, the nurse should. Here are the options. Option A. Serve high-calorie food she can carry with her. Option B. Encourage her appetite by sending out for her favorite foods. Option C. Serve her small, attractively arranged portions. Option D. Allow her in the unit kitchen for extra food whenever she pleases. The correct answer is option A. Serve high-calorie food she can carry with her. Not provided in source. Question 180. To maintain Brian's traction, the nurse must make certain that the child's. Here are the options. Option A. Hips are resting on the bed, with the legs suspended at a right angle to the bed. Option B. Hips are slightly elevated above the bed and the legs are suspended at a right angle to the bed. Option C. Hips are elevated above the level of the body on a pillow and the legs are suspended parallel to the bed. Option D. Hips and legs are flat on the bed, with the traction positioned at the foot of the bed. The correct answer is option B. Hips are slightly elevated above the bed and the legs are suspended at a right angle to the bed. Not provided in source. Question 181. Which action by the nurse indicates understanding of herpes zoster? Here are the options. Option A. The nurse covers the lesions with a sterile dressing. Option B. The nurse wears gloves when providing care. Option C. The nurse administers a prescribed antibiotic. Option D. The nurse administers oxygen. The correct answer is option B. The nurse wears gloves when providing care. Not provided in source. Question 182. There is an order for a trough to be drawn on the client receiving vancomycin. The nurse is aware that he should contact the lab for them to collect the blood. Here are the options. Option A, 15 minutes after the infusion. Option B, 30 minutes before the fourth infusion. Option C, 1 hour after the infusion. Option D, 2 hours after the infusion. The correct answer is option B, 30 minutes before the fourth infusion. Not provided in source. Question 183. The client using a diaphragm should be instructed to. Here are the options. Option A, refrain from keeping the diaphragm in longer than 4 hours. Option B, keep the diaphragm in a cool location. Option C, have the diaphragm resized if she gains 5 pounds. Option D, have the diaphragm resized if she has any surgery. The correct answer is option B. Keep the diaphragm in a cool location. Not provided in source. Question 184. The nurse is providing postpartum teaching for a mother planning to breastfeed her infant. Which of the client's statements indicates the need for additional teaching? Here are the options. Option A, I'm wearing a support bra. Option B, I'm expressing milk from my breast. Option C, I'm drinking 4 glasses of fluid during a 24-hour period. Option D, while I'm in the shower, I'll allow the water to run over my breasts. The correct answer is option C. I'm drinking 4 glasses of fluid during a 24-hour period. Not provided in source. Question 185. Damage to the Roman 7 cranial nerve results in. Here are the options. Option A, facial pain. Option B, absence of ability to smell. Option C, absence of eye movement. Option D, tinnitus. The correct answer is option A, facial pain. Not provided in source. Question 186. A client is receiving pyridium phenazopyridine hydrochloride for a urinary tract infection. The client should be taught that the medication may. Here are the options. Option A, cause diarrhea. Option B, change the color of her urine. Option C, cause mental confusion. Option D, cause changes in taste. The correct answer is option B, change the color of her urine. Not provided in source. Question 187. Which of the following tests should be performed before beginning a prescription of Accutane? Here are the options. Option A, check the calcium level. Option B, perform a pregnancy test. Option C, monitor apical pulse. Option D, obtain a creatinine level. The correct answer is option B, perform a pregnancy test. Not provided in source. Question 188. A client with AIDS is taking Zovirax acyclovir. Which nursing intervention is most critical during the administration of acyclovir? Here are the options. Option A, limit the client's activity. Option B, encourage a high carbohydrate diet. Option C, use an incentive spirometer to improve respiratory function. Option D, encourage fluids. The correct answer is option D, encourage fluids. Not provided in source. Question 189. A client is admitted for an CAT scan. The nurse should question the client regarding. Here are the options. Option A, pregnancy. Option B, a titanium hip replacement. Option C, allergies to antibiotics. Option D, inability to move his feet. The correct answer is option A, pregnancy. Not provided in source. Question 190. The nurse is caring for the client receiving amphotericin B. Which of the following indicates that the client has experienced toxicity to this drug? Here are the options. Option A, changes in vision. Option B, nausea. Option C, urinary frequency. Option D, changes in skin color. The correct answer is option D, changes in skin color. Not provided in source. Question 191. The nurse should visit which of the following clients first? Here are the options. Option A, the client with diabetes with a blood glucose of 95 mg/dl. Option B, the client with hypertension being maintained on lisinopril. Option C, the client with chest pain and a history of angina. Option D, the client with Raynaud's disease. The correct answer is option C, the client with chest pain and a history of angina. Not provided in source. Question 192. A client with cystic fibrosis is taking pancreatic enzymes. The nurse should administer this medication. Here are the options. Option A, once per day in the morning. Option B, 3 times per day with meals. Option C, once per day at bedtime. Option D, 4 times per day. The correct answer is option B, 3 times per day with meals. Not provided in source. Question 193. Cataracts result in opacity of the crystalline lens. Which of the following best explains the functions of the lens? Here are the options. Option A, the lens controls stimulation of the retina. Option B, the lens orchestrates eye movement. Option C, the lens focuses light rays on the retina. Option D, the lens magnifies small objects. The correct answer is option C, the lens focuses light rays on the retina. Not provided in source. Question 194. A client who has glaucoma is to have miotic eye drops instilled in both eyes. The nurse knows that the purpose of the medication is to. Here are the options. Option A, anesthetize the cornea. Option B, dilate the pupils. Option C, constrict the pupils. Option D, paralyze the muscles of accommodation. The correct answer is option C, constrict the pupils. Not provided in source. Question 195. A client with a severe corneal ulcer has an order for gentamicin GTT Q4 hours and neomycin 1 DTT Q4 hours. Which of the following schedules should be used when administering the drops? Here are the options. Option A, allow 5 minutes between the 2 medications. Option B, the medications may be used together. Option C, the medications should be separated by a cycloplegic drug. Option D, the medications should not be used in the same client. The correct answer is option A, allow 5 minutes between the 2 medications. Not provided in source. Question 196. The client with color blindness will most likely have problems distinguishing which of the following colors? Here are the options. Option A, orange. Option B, violet. Option C, red. Option D, white. The correct answer is option B, violet. Not provided in source. Question 197. The client with a pacemaker should be taught to. Here are the options. Option A, report ankle edema. Option B, check his blood pressure daily. Option C, refrain from using a microwave oven. Option D, monitor his pulse rate. The correct answer is option D, monitor his pulse rate. Not provided in source. Question 198. The client with enuresis is being taught regarding bladder retraining. The nurse should advise the client to refrain from drinking after. Here are the options. Option A, 1900. Option B, 1200. Option C, 1000. Option D, 070. The correct answer is option A, 1900. Not provided in source. Question 199. Which of the following diet instructions should be given to the client with recurring urinary tract infections? Here are the options. Option A, increase intake of meats. Option B, avoid citrus fruits. Option C, perform pericare with hydrogen peroxide. Option D, drink a glass of cranberry juice every day. The correct answer is option D, drink a glass of cranberry juice every day. Not provided in source. Question 200. The physician has prescribed NPH insulin for a client with diabetes mellitus. Which statement indicates that the client knows when the peak action of the insulin occurs? Here are the options. Option A, I will make sure I eat breakfast within 2 hours of taking my insulin. Option B, I will need to carry candy or some form of sugar with me all the time. Option C, I will eat a snack around 3 o'clock each afternoon. Option D, I can save my dessert from supper for a bedtime snack. The correct answer is option C, I will eat a snack around 3 o'clock each afternoon. Not provided in source. Question 201. A client with pneumocystis carinii pneumonia is receiving methotrexate. The rationale for administering leucovorin calcium to a client receiving methotrexate is to. Here are the options. Option A, treat anemia. Option B, create a synergistic effect. Option C, increase the number of white blood cells. Option D, reverse drug toxicity. The correct answer is option D, reverse drug toxicity. Not provided in source. Question 202. A client tells the nurse that she is allergic to eggs, dogs, rabbits, and chicken feathers. Which order should the nurse question? Here are the options. Option A, TB skin test. Option B, rubella vaccine. Option C, ELISA test. Option D, chest X-ray. The correct answer is option B, rubella vaccine. Not provided in source. Question 203. The physician has prescribed ranitidine Zantac for a client with erosive gastritis. The nurse should administer the medication. Here are the options. Option A, 30 minutes before meals. Option B, with each meal. Option C, in a single dose at bedtime. Option D, 60 minutes after meals. The correct answer is option B, with each meal. Not provided in source. Question 204. A temporary colostomy is performed on the client with colon cancer. The nurse is aware that the proximal end of a double-barrel colostomy. Here are the options. Option A is the opening on the client's left side. Option B is the opening on the distal end on the client's left side. Option C is the opening on the client's right side. Option D is the opening on the distal right side. The correct answer is option C, is the opening on the client's right side. Not provided in source. Question 205. While assessing the postpartum client, the nurse notes that the fundus is displaced to the right. Based on this finding, the nurse should. Here are the options. Option A, ask the client to void. Option B, assess the blood pressure for hypotension. Option C, administer oxytocin. Option D, check for vaginal bleeding. The correct answer is option A, ask the client to void. Not provided in source. Question 206. The physician has ordered an MRI for a client with an orthopedic ailment. An MRI should not be done if the client has. Here are the options. Option A, the need for oxygen therapy. Option B, a history of claustrophobia. Option C, a permanent pacemaker. Option D, sensory deafness. The correct answer is option C, a permanent pacemaker. Not provided in source. Question 207. A 6-month-old client is placed on strict bed rest following a hernia repair. Which toy is best suited to the client? Here are the options. Option A, colorful crib mobile. Option B, handheld electronic games. Option C, cars in a plastic container. Option D, 30-piece jigsaw puzzle. The correct answer is option C, cars in a plastic container. Not provided in source. Question 208. The nurse is preparing to discharge a client with a long history of polio. The nurse should tell the client that. Here are the options. Option A, taking a hot bath will decrease stiffness and spasticity. Option B, a schedule of strenuous exercise will improve muscle strength. Option C, rest periods should be scheduled throughout the day. Option D, visual disturbances can be corrected with prescription glasses. The correct answer is option C. Rest periods should be scheduled throughout the day. Not provided in source. Question 209. A client on the postpartum unit has a proctopisiotomy. The nurse should anticipate administering which medication? Here are the options. Option A, Dulcolax suppository. Option B, docusate sodium callase. Option C, methergonavine malate methergin. Option D, bromocriptine sulfate parlodal. The correct answer is option B, docusate sodium callase. Not provided in source. Question 210. A client with pancreatic cancer has an infusion of TPN total parenteral nutrition. The doctor has ordered for sliding scale insulin. The most likely explanation for this order is, here are the options. Option A. Total parenteral nutrition leads to negative nitrogen balance and elevated glucose levels. Option B. Total parenteral nutrition cannot be managed with oral hypoglycemics. Option C. Total parenteral nutrition is a high glucose solution that often elevates the blood glucose levels. Option D. Total parenteral nutrition leads to further pancreatic disease. The correct answer is option C. Total parenteral nutrition is a high glucose solution that often elevates the blood glucose levels. Not provided in source. Question 211. An adolescent prima gravida who is 10 weeks pregnant attends the antepartum clinic for a first checkup. To develop a teaching plan, the nurse should initially assess. Here are the options. Option A. The client's knowledge of the signs of preterm labor. Option B. The client's feelings about the pregnancy. Option C. Whether the client was using a method of birth control. Option D. The client's thought about future children. The correct answer is option B. The client's feelings about the pregnancy. Not provided in source. Question 212. An obstetric client is admitted with dehydration. Which Roman IV fluid would be most appropriate for the client? Here are the options. Option A. 0.45 normal saline. Option B. Dextrose 1% in water. Option C. Lactated ringers. Option D. Dextrose 5% in 0.45 normal saline. The correct answer is option A. 0.45 normal saline. Not provided in source. Question 213. The physician has ordered a thyroid scan to confirm the diagnosis of a goiter. Before the procedure, the nurse should. Here are the options. Option A. Assess the client for allergies. Option B. Bolus the client with Roman IV fluid. Option C. Tell the client he will be asleep. Option D. Insert a urinary catheter. The correct answer is option A. Assess the client for allergies. Not provided in source. Question 214. The physician has ordered an injection of RhoGAM for a client with blood type A negative. The nurse understands that RhoGAM is given to. Here are the options. Option A. Provide immunity against Rh isoenzymes. Option B. Prevent the formation of Rh antibodies. Option C. Eliminate circulating Rh antibodies. Option D. Convert the Rh factor from negative to positive. The correct answer is option B. Prevent the formation of Rh antibodies. Not provided in source. Question 215. The nurse is caring for a client admitted to the emergency room after a fall. X-rays reveal that the client has several fractured bones in the foot. Which treatment should the nurse anticipate for the fractured foot? Here are the options. Option A. Application of a short inclusive spica cast. Option B. Stabilization with a plaster of Paris cast. Option C. Surgery with Kirschner wire implantation. Option D. A gauze dressing only. The correct answer is option B. Stabilization with a plaster of Paris cast. Not provided in source. Question 216. A client with bladder cancer is being treated with iridium seed implants. The nurse's discharge teaching should include telling the client to. Here are the options. Option A. Strain his urine. Option B. Increase his fluid intake. Option C. Report urinary frequency. Option D. Avoid prolonged sitting. The correct answer is option A. Strain his urine. Not provided in source. Question 217. Following a heart transplant, a client is started on medication to prevent organ rejection. Which category of medication prevents the formation of antibodies against the new organ? Here are the options. Option A. Antivirals. Option B. Antibiotics. Option C. Immunosuppressants. Option D. Analgesics. The correct answer is option C. Immunosuppressants. Not provided in source. Question 218. The nurse is preparing a client for cataract surgery. The nurse is aware that the procedure will use. Here are the options. Option A. Mydriatics to facilitate removal. Option B. Miotic medication such as Timoptic. Option C. A laser to smooth and reshape the lens. Option D. Silicone oil injections into the eyeball. The correct answer is option A. Mydriatics to facilitate removal. Not provided in source. Question 219. A client with Alzheimer's disease is awaiting placement in a skilled nursing facility. Which long-term plans would be most therapeutic for the client? Here are the options. Option A. Placing mirrors in several locations in the home. Option B. Placing a picture of herself in her bedroom. Option C. Placing simple signs to indicate the location of the bedroom, bathroom, and so on. Option D. Alternating healthcare workers to prevent boredom. The correct answer is option C. Placing simple signs to indicate the location of the bedroom, bathroom, and so on. Not provided in source. Question 220. A client with an abdominal cholecystectomy returns from surgery with a Jackson-Pratt drain. The chief purpose of the Jackson-Pratt drain is to. Here are the options. Option A. Prevent the need for dressing changes. Option B. Reduce edema at the incision. Option C. Provide for wound drainage. Option D. Keep the common bile duct open. The correct answer is option C. Provide for wound drainage. Not provided in source. Question 221. The nurse is performing an initial assessment of a newborn Caucasian male delivered at 32 weeks gestation. The nurse can expect to find the presence of. Here are the options. Option A. Mongolian spots. Option B. Scrotal rugae. Option C. Head lag. Option D. Polyhydramnios. The correct answer is option C. Head lag. Not provided in source. Question 222. The nurse is caring for a client admitted with multiple trauma. Fractures include the pelvis, femur, and ulna. Which finding should be reported to the physician immediately? Here are the options. Option A. Hematuria. Option B. Muscle spasms. Option C. Dizziness. Option D. Nausea. The correct answer is option A, hematuria. Not provided in source. Question 223. A client is brought to the emergency room by the police. He is combative and yells, "I have to get out of here. They are trying to kill me." Which assessment is most likely correct in relation to this statement? Here are the options. Option A. The client is experiencing an auditory hallucination. Option B. The client is having a delusion of grandeur. Option C. The client is experiencing paranoid delusions. Option D. The client is intoxicated. The correct answer is option C. The client is experiencing paranoid delusions. Not provided in source. Question 224. The nurse is preparing to suction the client with a tracheotomy. The nurse notes a previously used bottle of normal saline on the client's bedside table. There is no label to indicate the date or time of initial use. The nurse should. Here are the options. Option A. Lip the bottle and use a pack of sterile 4x4 for the dressing. Option B. Obtain a new bottle and label it with the date and time of first use. Option C. Ask the ward secretary when the solution was requested. Option D. Label the existing bottle with the current date and time. The correct answer is option B. Obtain a new bottle and label it with the date and time of first use. Not provided in source. Question 225. An infant's UPGAR score is 9 at 5 minutes. The nurse is aware that the most likely cause for the deduction of 1 point is. Here are the options. Option A. The baby is hypothermic. Option B. The baby is experiencing bradycardia. Option C. The baby's hands and feet are blue. Option D. The baby is lethargic. The correct answer is option C. The baby's hands and feet are blue. Not provided in source. Question 226. The primary reason for rapid continuous rewarming of the area affected by frostbite is to. Here are the options. Option A. Lessen the amount of cellular damage. Option B. Prevent the formation of blisters. Option C. Promote movement. Option D. Prevent pain and discomfort. The correct answer is option A. Lessen the amount of cellular damage. Not provided in source. Question 227. A client recently started on hemodialysis wants to know how the dialysis will take the place of his kidneys. The nurse's response is based on the knowledge that hemodialysis works by. Here are the options. Option A. Passing water through a dialyzing membrane. Option B. Eliminating plasma proteins from the blood. Option C. Lowering the pH by removing non-volatile acids. Option D. Filtering waste through a dialyzing membrane. The correct answer is option D. Filtering waste through a dialyzing membrane. Not provided in source. Question 228. During a home visit, a client with AIDS tells the nurse that he has been exposed to measles. Which action by the nurse is most appropriate? Here are the options. Option A. Administer an antibiotic. Option B. Contact the physician for an order for immune globulin. Option C. Administer an antiviral. Option D. Tell the client that he should remain in isolation for 2 weeks. The correct answer is option B. Contact the physician for an order for immunoglobulin. Not provided in source. Question 229. A client hospitalized with MRSA is placed on contact precautions. Which statement is true regarding precautions for infections spread by contact? Here are the options. Option A. The client should be placed in a room with negative pressure. Option B. Infection requires close contact, therefore, the door may remain open. Option C. Transmission is highly likely, so the client should wear a mask at all times. Option D. Infection requires skin-to-skin contact and is prevented by hand washing, gloves, and a gown. The correct answer is option D. Infection requires skin-to-skin contact and is prevented by hand washing, gloves, and a gown. Not provided in source. Question 230. A client who is admitted with an above-the-knee amputation tells the nurse that his foot hurts and itches. Which response by the nurse indicates understanding of phantom limb pain? Here are the options. Option A. The pain will go away in a few days. Option B. The pain is due to peripheral nervous system interruptions. I will get you some pain medication. Option C. The pain is psychological because your foot is no longer there. Option D. The pain and itching are due to the infection you had before the surgery. The correct answer is option B. The pain is due to peripheral nervous system interruptions. I will get you some pain medication. Not provided in source. Question 231. A client with cancer of the pancreas has undergone a Whipple procedure. The nurse is aware that during the Whipple procedure, the doctor will remove the. Here are the options. Option A. Head of the pancreas. Option B. Proximal third section of the small intestines. Option C. Stomach and duodenum. Option D. Esophagus and jejunum. The correct answer is option A. Head of the pancreas. Not provided in source. Question 232. The physician has ordered a minimal bacteria diet for a client with neutropenia. The client should be taught to avoid eating. Here are the options. Option A. Fruits. Option B. Salt. Option C. Pepper. Option D. Ketchup. The correct answer is option C. Pepper. Not provided in source. Question 233. A client is discharged home with a prescription for Coumadin sodium warfarin. The client should be instructed to. Here are the options. Option A. Have a pro time done monthly. Option B. Eat more fruits and vegetables. Option C. Drink more liquids. Option D. Avoid crowds. The correct answer is option A. Have a pro time done monthly. Not provided in source. Question 234. The nurse is assisting the physician with removal of a central venous catheter. To facilitate removal, the nurse should instruct the client to. Here are the options. Option A. Perform the Valsalva maneuver as the catheter is advanced. Option B. Turn his head to the left side and hyperextend the neck. Option C. Take slow, deep breaths as the catheter is removed. Option D. Turn his head to the right while maintaining a sniffing position. The correct answer is option A. Perform the Valsalva maneuver as the catheter is advanced. Not provided in source. Question 235. A client has an order for streptokinase. Before administering the medication, the nurse should assess the client for. Here are the options. Option A. Allergies to pineapples and bananas. Option B. A history of streptococcal infections. Option C. Prior therapy with phenytoin. Option D. A history of alcohol abuse. The correct answer is option B. A history of streptococcal infections. Not provided in source. Question 236. The nurse is providing discharge teaching for the client with leukemia. The client should be told to avoid. Here are the options. Option A. Using oil or cream-based soaps. Option B. Flossing between the teeth. Option C. The intake of salt. Option D. Using an electric razor. The correct answer is option B. Flossing between the teeth. Not provided in source. Question 237. The nurse is changing the ties of the client with a tracheotomy. The safest method of changing the tracheotomy ties is to. Here are the options. Option A. Apply the new tie before removing the old one. Option B. Have a helper present. Option C. Hold the tracheotomy with the non-dominant hand while removing the old tie. Option D. Ask the doctor to suture the tracheostomy in place. The correct answer is option A. Apply the new tie before removing the old one. Not provided in source. Question 238. The nurse is monitoring a client following a lung resection. The hourly output from the chest tube was 300 ml. The nurse should give priority to. Here are the options. Option A. Turning the client to the left side. Option B. Milking the tube to ensure patency. Option C. Slowing the intravenous infusion. Option D. Notifying the physician. The correct answer is option D. Notifying the physician. Not provided in source. Question 239. The infant is admitted to the unit with tetralogy of Fallot. The nurse would anticipate an order for which medication? Here are the options. Option A. Dicloxin. Option B. Epinephrine. Option C. Aminophylline. Option D. Atropine. The correct answer is option A. Dicloxin. Not provided in source. Question 240. The nurse is educating the ladies' club in self-breast exam. The nurse is aware that most malignant breast masses occur in the tail of Spence. On the diagram, place an X on the tail of Spence. Here are the options. Option A. Upper inner quadrant. Option B. Lower inner quadrant. Option C. Lower outer quadrant. Option D. Upper outer quadrant / axillary tail. The correct answer is option D. Upper outer quadrant / axillary tail. Not provided in source. Question 241. The toddler is admitted with a cardiac anomaly. The nurse is aware that the infant with a ventricular septal defect will. Here are the options. Option A. Tire easily. Option B. Grow normally. Option C. Need more calories. Option D. Be more susceptible to viral infections. The correct answer is option A. Tire easily. Not provided in source. Question 242. The nurse is monitoring a client with a history of stillborn infants. The nurse is aware that a non-stress test can be ordered for this client too. Here are the options. Option A. Determine lung maturity. Option B. Measure the fetal activity. Option C. Show the effect of contractions on fetal heart rate. Option D. Measure the well-being of the fetus. The correct answer is option B. Measure the fetal activity. Not provided in source. Question 243. The nurse is evaluating the client who was admitted 8 hours ago for induction of labor. The monitor graph shows decelerations. Which action should be taken first by the nurse? Here are the options. Option A. Instruct the client to push. Option B. Perform a vaginal exam. Option C. Turn off the pitocin infusion. Option D. Place the client in a semi-Fowler's position. The correct answer is option C. Turn off the pitocin infusion. Not provided in source. Question 244. The nurse notes the following on the ECG monitor. The nurse would evaluate the cardiac arrhythmia as, here are the options. Option A. Atrial flutter. Option B. A sinus rhythm. Option C. Ventricular tachycardia. Option D. Atrial fibrillation. The correct answer is option C. Ventricular tachycardia. Not provided in source. Question 245. A client with clotting disorder has an order to continue Lovenox and noxaparin injections after discharge. The nurse should teach the client that Lovenox injections should. Here are the options. Option A. Be injected into the deltoid muscle. Option B. Be injected into the abdomen. Option C. Aspirate after the injection. Option D. Clear the air from the syringe before injections. The correct answer is option B. Be injected into the abdomen. Not provided in source. Question 246. The nurse has a pre-op order to administer Valium diazepam 10 mg and Phenergan promethazine 25 mg. The correct method of administering these medications is to. Here are the options. Option A. Administer the medications together in one syringe. Option B. Administer the medication separately. Option C. Administer the Valium, wait 5 minutes, and then inject the Phenergan. Option D. Question the order because they cannot be given at the same time. The correct answer is option B. Administer the medication separately. Not provided in source. Question 247. A client with frequent urinary tract infections asks the nurse how she can prevent the reoccurrence. The nurse should teach the client to. Here are the options. Option A. Douche after intercourse. Option B. Void every 3 hours. Option C. Obtain a urinalysis monthly. Option D. Wipe from back to front after voiding. The correct answer is option B. Void every 3 hours. Not provided in source. Question 248. Which task should be assigned to the nursing assistant? Here are the options. Option A. Placing the client in seclusion. Option B. Emptying the Foley catheter of the preclamptic client. Option C. Feeding the client with dementia. Option D. Ambulating the client with a fractured hip. The correct answer is option C. Feeding the client with dementia. Not provided in source. Question 249. The client has recently returned from having a thyroidectomy. The nurse should keep which of the following at the bedside? Here are the options. Option A. A tracheotomy set. Option B. A padded tongue blade. Option C. An endotracheal tube. Option D. An airway. The correct answer is option A. A tracheotomy set. Not provided in source. Question 250. The physician has ordered a histoplasmosis test for the elderly client. The nurse is aware that histoplasmosis is transmitted to humans by. Here are the options. Option A. Cats. Option B. Dogs. Option C. Turtles. Option D. Birds. The correct answer is option D. Birds. Not provided in source.